Well, Tarek Yasharovich is a WHO spokesperson, joins us live from Geneva. Good to have you with us. So first of all, what do you make of the intensification of attacks that we've been seeing, attacks and sieges on medical facilities and aid facilities in the last 24, 48 hours?
Well, what this means, it means more people being injured in relentless bombardment and fighting, going ever more to the south of Gaza, and these injured people not being able to get medical care they need simply because, as you have just described, many hospitals are not working. There is no specialized staff. There is no medicines. And in many instances, it's simply impossible to reach hospitals because roads are damaged and because there's an insecurity. Now, for us as WHO and other humanitarians, we were trying as much as possible to reach hospitals that are still functioning, and only 14 out of 36 hospitals in Gaza are functioning at a minimal level, but it was really difficult to get there. Many times our missions have not been granted security clearances to go there. There were delays at the checkpoints, and simply it wasn't possible to reach hospitals. And that all creates basically the situation, as your reporter has described, where you have injured people, you have people with chronic diseases, you have pregnant women. All these people need medical care, they need health services, and those health services are less and less available. And on top of all of that, you have a spread of infectious diseases, waterborne diseases, respiratory viruses, skin diseases. So the situation is getting only worse with every day, and really what we are appealing for and what we were saying all along, the only solution really is ceasefire to stop bombs raining down on Gaza.
Tarek, you mentioned quite a bit. I'm going to try and unpack it. But first of all, do we have any idea how many people are dying each day simply because what would otherwise be easily obtainable medicine is something out of their reach?
Well, according to the Ministry of Health, 26,000 people have been killed, mainly due to bombardment. But if we keep conditions as bad as they are, and they're getting only worse, we will have even more people dying from not being able to receive medical care. So again, people with cancer, people with diabetes, people who need renal dialysis, people simply who have conditions that require going to seek doctor. And then we have reports of hepatitis A, we have reports of diarrheal diseases among children, the respiratory viruses. So immunity is going down. People are also hungry. Our trucks are constantly being stopped by people who just hope there is a food in those trucks. And we have to explain them it's medicines. So people are hungry. People live in unsanitary conditions with no access to toilets, with no access to clean water. So it's a really deadly combination which will increase the mortality. So really we need access to hospitals to preserve of what is left of the health system. And we need eventually, really, we need a ceasefire. Otherwise, the death toll will just increase more.
Tarek, you mentioned that your convoys are sometimes held up, stopped by checkpoints. And I'm wondering, in your conversations with Israeli authorities, when you ask for access, what kind of response do you get?
Well, we are always ready on a daily basis to go and deliver what we have to hospitals they need. What we need really guarantees that we can go where we are going. And
what kind of response do you get, Tarek, though, when you ask for those guarantees? When you say people are going to die in this area unless we can reach it, we need those guarantees. What reply do you get?
Well, often those guarantees simply do not come. And when they come, when we go, there are delays at checkpoints. Unnecessary delays. That there were instances where health workers from Palestinian Red Crescent have been detained, and then after long delays, when we get, for example, to Al-Shifa hospital in the north of Gaza, then we simply don't have enough of time to do what we would like to do. So really, we kept, sending this plea to Israel to have this access, because we as a humanitarians, we need to have that humanitarian space to operate. But again, just to go a step back again, even if we have that access, even if we can bring medical supplies inside, as long as there is a bombardment, as long as there is a fighting, more and more people will get injured. So really, the only solution is to stop the violence.
All right, we'll leave it there. Thanks so much for your time in explaining this tragic situation to us. Tarek Yasharovich.
Thank you.